This instructional video will go along with the medical record chart video. This will explain the patient medical record forms that are filed within the medical record chart and behind each divider. The first form I want to discuss is the patient registration form. Again, this information is this patient registration form is called by many names. It also could be called the patient information sheet and also the face sheet. It would be filed on the left hand, on my right, but if you're looking at it, the left-hand side of the chart, it's the first thing you're going to see when you open the chart. It validates who the patient's name and information matches the outside of the chart. It possesses, again, different information. The patient demographic information, which is, the definition is patient identification information. In HIPAA, it's also considered protected health information, PHI. Its examples are patient's name, address, date of birth. Then you're going to have financial information, which is the insurance information of the patient. Filed directly behind that is the medication administrative sheet. They call it medication log. It's just in a paper medical record system, it's a listing of all the medication that the patient's receiving, dose, quantity, its frequency. And that would be, again, be filed behind, on the left-hand side of the chart, the registration form. The dividers, the first divider would be history and physical. Filed behind that is, here's a copy of the patient's history and physical. Again, the patient's present history, past, family, social history would be listed on this, along with the system review of problems that the patient had in the past or is currently having. Next divider is progress notes. Again, this is a document that documents the patient's treatment. It's by different discipline. The physician has their progress notes, nurses have theirs. The ancillary services, the ancillary meaning secondary, would be physical therapy, speech therapy, dietary, social service. Never do you combine doctor's progress notes with any other service or ancillary service. The doctor's progress notes might be written in a SOAP format. All information behind these dividers are filed again in reverse chronological order, most recent on top, with the first day of documentation would be on the bottom. The reason for this is the doctor and the other disciplines wants to see the most recent information instead of having to page through it. Next section is correspondence. That's any information we receive through the mail on the patient or we send out on the patient. An example of a form filed behind correspondence would be a release of information form that we are sending out to another facility to get information that's pertinent for the patient's treatment, operation, surgical procedure they're having performed at the facility. The next divider is lab and x-ray. Sometimes it's combined, sometimes it would be separate. However, in our case, we've combined lab and x-rays. Again, it's going to list all the patient's labs and radiology imaging reports that they receive. Again, in reverse chronological order, most recent on top. The labs would be packaged together, and then the radiology reports would be packaged together. Here's an example of a lab sheet. And here's an example of a radiology report. Next divider is hospital. Really, we don't have anything filed behind here. However, this is information, as I was telling you on the release of information form. If we sent to another facility to send their information to us, we would file their information behind here so it doesn't get intermingled or mistaken for information that's been documented on the patient for this visit. When the doctor said, hey, did we get the information from whatever hospital they might have requested from, they can go behind this divider and look at it and obtain the information they're seeking. The insurance tab is the next tab divider. And an example, again, that would be insurance information, billing information, and an example of a form filed behind that is the CMS 1500 form. The miscellaneous divider is the next divider I want to talk about, and we are going to put consent forms behind here. For example, the notice of privacy practices. This is for HIPAA purposes. It explains how we handle patient information to other facilities and how we handle the information internally for treatment, operation, or payment purposes. This is an informational consent form. We would file that behind miscellaneous too. This ensures if the patient's having a surgical procedure performed that they have all the pros and risks explained to them. Alternative procedures to the surgical procedure would also be explained. The patient signs this. This is for liability purposes. It protects the physician from malpractice, possible malpractice litigation. The last divider is a blank divider that the facility could use for whatever purpose it would like. Thank you very much.